Welcome to another episode of the Granite List Live, where we discuss all things related to employee benefits and human capital. I'm Lee Dill, and I'm thrilled to be joined by Cal Beyer. He is the Senior Director of Safe Workplaces at the national nonprofit SAFE Project. Cal, thanks so much for joining me today.
Thank you so much for having me, Lee. It was great to see you recently in Nashville for Health Benefits Nation.
That was a great conference, and lots of great conversations. And I know we spoke there originally talking about your mission and your passion of what you do to really promote first dose prevention strategies. Can you give me a little bit of background, and our audience a little bit of background on what you do?
Yes, Lee, thank you. I have been on a mission for many years. I do a lot of work as a risk management professional. So for 35 years, I've been a risk manager and safety professional, starting first in the casualty space and then migrating to the employee benefit space, because I really believed we could do more on opioid risk reduction and overall on addiction treatment and recovery in employee benefits. So I helped launch a mental health and suicide prevention initiative when I was working for a construction company starting in 2014. And we took this initiative and morphed it into a movement. But the biggest challenge we faced before we can really affect suicide, I found that substance use disorder was a big issue. And the nation has been battling the overdose crisis in our third decade. And I felt I could go to SAFE Project and really be a champion for change, help educate employers about the risks of addiction, and especially focus on overdose prevention. So it's been a really fun and challenging, mostly rewarding, but it can be a sad experience. But I want people to know we can focus on change and make a difference in the lives of our workers, their families, and the communities that all of us are working in.
I love what you're doing, and it's so important because I would imagine that just about everyone has a story that they know somebody who has had addiction. And the opioid crisis is real, and it's sad. So whatever we can do to mitigate the risk of someone going down a path that might not be the one they want to. Can you tell us a little bit more about your mission of talking about surgeries that might open the door to the path of addiction, really mitigating the risk with those medical, dental, vision surgeries? What are the other options that are available, and what are you talking to employers about?
Yeah, Lee, this story is a personal story. I myself grew up in a family where a family member had chronic pain from prior injuries. And then I had a knee operation at 11, a second at about 12, and a third around 14. And I found when I had emotional pain, I took additional pain medication. And it did numb that pain, first the physical, then the emotional pain. But I was very concerned about my overall well being. And I felt like this could happen to me, it could happen to anyone. So the most powerful thing is for everyone to think about the people in our lives and to avoid judgment and to recognize that addiction sometimes is an escape, and sometimes that self-medication is intended to numb either physical or emotional pain. Taking away the stigma by talking about it is powerful, and taking away the judgment is powerful. Because my own experience involved surgical procedures, when I went to have my wisdom teeth out a few years later, I had to explain to the dentist that I should not have opioid prescriptions. I ended up getting a prescription, but it was very moderated because I let him know I'd had that prior issue of prescription pain misuse. And then I became an advocate within my own family to talk to my siblings. And that was before there was medical literature. It was before the opioid crisis. That's 49 years ago for me. But Lee, what I noticed as a risk manager in workers' compensation injuries and employee benefit surgeries, frequently people who had a surgical procedure ended up with an addiction down the road. And I felt like we could do more as employers to talk to people about the risks involved. And It's been a slow process, but what we have seen is growing traction around multimodal pain management or alternatives to opioid pain management. And that's a really powerful strategy. So there are products for most major categories of surgical procedures that will be available to be included in employee benefit plans. Secondly, there are strategies around using alternative pain medications. Staggering ibuprofen and acetaminophen, for example, has been shown to produce more pain relieving power than OxyContin, which is a category of opioids that were overprescribed at the onset of the nation's overdose crisis. So collectively, we can learn more. We can ask questions to help safeguard ourselves when we have medical, dental, and surgical procedures. We can do the same for our employees. We can do the same for our family members and for our employee family members. And what that does, if we can reduce the number of opioids prescribed, we can reduce the amount left over. That can reduce the risk of unnecessary overdose exposure.
Well, and talking about this through the workplace is so important too, because most people receive their benefits from their employer, and having other options or knowing that you have a choice of where to get those surgeries is important. And so tell me a little bit, through your work, you talk to employers about mitigating the risk and that they should have naloxone at every workplace. Tell me how you work with employer groups and, besides talking about just the surgery options, but what they can tell their employees.
Yeah, I think this is really important. Some industries have an elevated risk of overdose deaths. And that was really powerful information that came out in August of 2023. The Centers for Disease Control looked at 22 different industry groupings, and the construction industry was the highest. And it's really what I was suspecting through my work with mental health and suicide prevention. I knew that construction had a lot of muscular skeletal injuries and that a lot of workers were prescribed opioids. So I had been educating employers about naloxone, also known as Narcan. The generic name is naloxone. Narcan happens to be a brand name for Emergent Biosolutions product, but there are many generic options available as well. That's the medication that is an opioid antagonist. Its sole purpose is to reverse the effects of opioids, the effect of receptors on the brain. It keeps the medication from binding, which reduces the risk of an overdose and then actually will reverse the effects of an overdose. So, this is a powerful tool in the overdose prevention strategy. It's also a risk management practice. Having naloxone on a job site is helpful in an emergency action plan. Different people can overdose for different reasons. So, on a job site or in the workplace, we have visitors and we have guests, we have vendors, we have partners, we have citizens coming into our offices, regardless of what type of industry we are. Our customers could have an overdose. So, being prepared with naloxone on site and then having people available to be trained can reduce the risk of an overdose, which could reduce the risk of a death on your premises. So you can see why this is a good public health strategy. It's also a good risk management strategy. Too many people think there's liability, but it's covered by a Good Samaritan statute. So it does provide protection. And in some cases, as more businesses engage with naloxone in the workplace, if you don't have it, people could say you didn't meet a standard of care to help provide protection for people. But bottom line, this is about saving lives and it's about human capital risk management. So that's what I do, educate employers about the risks and then identify strategies to help reduce the risk of harm to humans. Those first dose prevention strategies are one way by educating employees. about the alternatives of non opioid pain management, teaching them how to find doctors that will practice a more conservative approach, maybe using physical therapy for those musculoskeletal injuries before starting a regimen of opioids. There are many strategies, but I believe what's powerful is in that medical, dental, and surgical procedures, you have an opportunity to really coach your employees to be aware of the risk, to ask better questions. In this journey, I came across a company called Goldfinch Health, and their core business is to optimize surgical outcomes. And I learned a lot about multimodal pain management from their CEO. His name is Brand Newland, and Brand, as a pharmacist with a specialty in pain management, understood the challenges of opioids and the potential for addiction. And he and his team started looking at the alternatives that were available and then seeing the efficacy of faster healing when fewer opioids were being used. So they've used the term opioid sparing, and that's a really powerful tool. For individuals who are in recovery for long term addiction, avoiding opioids altogether is possible and may be recommended. So it's a really, to me, one of the most effective strategies that can reduce risk. And by having fewer opioids prescribed, fewer will be left over at the end of that rehabilitation process. Fewer leftover pills reduces overdose risk in a household.
Yeah, that's wonderful. And it all starts, education and then going to a place of care that looks out for your medical journey down the road and those around you by steering away from those opioids.
It's powerful, right?
It is.
And just by educating people, you can make the change that you want to see in the world. One example, in July of 2022, the Journal of the American Medical Association released a study done in Oregon, 840,000 patients, and it looked at the risk of overdose in a household when there were opioid prescriptions. So, what it showed was a 60% increased risk of overdose in a household with the first prescription of opioids. That risk increased to 625% with the second and subsequent prescription.
Wow.
So, not an overdose just to the patient, but to a family member. And that really hammered home that we need to teach people about at home disposal. So, every year, the Drug Enforcement Administration has take back programs, and many law enforcement agencies will participate. But that takes a lot of effort for people to remember.
Mhm.
And people are busy outside the workday. So when those are held on a Saturday, many parents have responsibilities and grandparents to teach or coach or to attend children's dance recitals or ballet practice or gymnastics or soccer and football, right?
Mhm.
So what we need to do is find alternative strategies. And there are a range of drug deactivation products that allow safe and environmentally friendly disposal in our homes. So some of those products are called Deterra. They have drug deactivation pouches. RX Destroyer is another product that's available. And then Dispose RX is a third that are available for household use. Many Costco type stores, Walgreens, CVS, and other commercial retail outlets will have those be available. But I am seeing more employers provide those when they do a toolbox talk or they do a stand down about opioid safety. That's a way to encourage action while you're educating employees. A couple of years ago, I had an employer with about 400 employees. In 10 days, they passed out products. 10 days later, they determined they'd had 3,200 leftover pills in their homes as employees. And the owner of the company was thrilled that he helped reduce that risk. So family members wouldn't be exposed to potential for overdose or creating a new addiction.
Right. That's amazing and incredible. You're doing some wonderful work. And if anybody wants to get in touch with you to bring this powerful education opportunity to their managers, to their C suite, to their employees, and, learn. I'm curious, how do you even get a prescription for naloxone at your place of work? That's a hurdle that I'm sure a lot of people don't even know how to overcome.
So, what's powerful, as of March 29th, 2023, naloxone is now available as an over the counter medication. So, you can actually go to any major pharmacy chain is stocking naloxone, and it's available over the counter. But many employers are saying, wow, I've got multiple locations, multiple storefronts, many areas where I have employees gathered. I want to have naloxone in the workplace. Some of them are putting them where they have AEDs, those
Mhm.
automated external defibrillators,
Mhm.
in case of a sudden cardiac arrest, or in their first aid kits. But I think that's one powerful strategy. Seeing many employers put this in supervisory vehicles. So they have that as work crews are out moving from location to location. So they're ready to respond in case of an emergency. Those are a couple of the strategies. And there are some group and bulk purchase options. We do have a program with Emergent Biosolutions and other suppliers where we can provide that. Many of those distributors or manufacturers make that available as well. But it's gotten so much easier to find this through a local pharmacy. You can place orders. So that's really not the barrier anymore. The barrier is deciding that we're going to do something and build this into our emergency action plans. And I'm happy to provide guidance to any employer that wants to talk about how do we go about doing this for naloxone. You can find additional information, including some training resources, at our website, www.safeproject.us. And people can send me an email at cal, at safeproject.us if they're interested in learning more. I write a lot of articles, Lee. I've got a 17-part series in the construction industry that is featuring companies and leaders and best practices of how we can reduce the risks of opioids, and then specifically focusing around strategies like naloxone and how we can help employers be better prepared. And I have a couple of deep dive articles coming out in the next several weeks, and I'll make certain to share those with you and Sally Pace so you can share that with your stakeholder community as well.
Well, thank you. And it all starts by education to mitigate that risk.
Education leads to stigma reduction. And once we break down the stigma, we reduce the fear of the unknown. We help make this a more comfortable conversation. People are leaning in. I'm seeing every week. Earlier this week, 250 employers visited the White House, and there was a strategy, a call to action to reduce overdoses in workplaces using naloxone. And that was just a really telling story. Different people are not viewing this as a political issue, they're viewing it as a life safety issue. And it's all about your mission as well, human capital. And I think this is just a powerful example of what we can do when we work together. We can save lives.
You're exactly right. And thank you for joining me. And thank you for sharing your mission and your passion, Cal. You're doing some wonderful things and saving lives.
Thank you, Lee. I'm so grateful to know you and Sally, and I'm so grateful that organizations like the Validation Institute have really legitimized this topic as an employee benefit opportunity. So I'm happy to be of assistance to any of your listeners that would like to learn more. Happy to share resources. And just thanks for amplifying these messages, Lee. It means a lot.
Absolutely. Well, Cal, thank you for joining us for another episode of the Granite List Live.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.